conversation of how do we pacify pain and how do we use medicine for pain, we should be talking about how do we make pain go away. Thank you very much.
Hello and welcome back to A Better World. This is your host, Mitchell J. Rabin, and I'm very glad you're joining us again today. Today we're going to have a very interesting show. I have invited Dr. Hal Blatman on. Hal is a specialist in pain, one of those things we rarely like to talk about or deal with. Yet, he has found ways of dealing with it and understanding it that have changed the field. And he has an extraordinary background, actually, in pain management. He's written a book on the subject. He's traveled the world giving lectures on it. And he's here today to educate us about the nature of it. And we can learn a lot. I've been learning a lot just recently about how to understand what it is and what we can do about it. So, Hal, great to have you.
Mitch, wonderful to meet you too, and wonderful to be here. Thank you so much.
Absolutely, my pleasure. So you've been educating me about this. Now I'd love to educate our audience about another understanding of what pain is and where it comes from and what to do about it. So where do you want to start with this?
Well, let's start with some of the things that we've been taught that aren't so true, just to kind of level the field.
Yeah, please.
Because we've been taught that pain comes from inflammation. We've been taught that pain comes from nerves being pinched by discs. We've been taught that bulging discs might cause pain. All those things. And most of what we were taught about pain is not the way our biology works.
But does inflammation cause pain?
Inflammation causes a reaction in our body that makes pain worse. So yes, inflammation can cause pain. But at the same time, our bodies are designed to have inflammation for two main reasons: for repair and for defense. If we have inflammation that's causing us pain, we have a repair deficit. We have an injury big enough that we're not able to repair it, and our biology has to shift to a defense mode and make us hurt.
Oh, as a signal.
As a signal.
Okay. So you're making a point that I do know about inflammation, because we tend to just say to that inflammation, and that's not the case.
No, we don't want to defeat
it. Serves
we
the
want
purpose.
to use it. Right.
It serves, as you said, the repair purpose, etc. It's just that when it gets excess and is not doing the repair,
then
the pain signals start in.
Yeah. Ankle sprain is a good way to think about that. What are we taught to do with ankles? We're taught to ice them and wrap them and elevate them, right? Ice
and nobody knows what to do. You know, there's a bit of a toss-up about which
So this may
direction to
help
go
level
in.
the field. When you sprain your ankle, what does your body do with it? Does it warm it up or does it cool it down?
Heats it up.
Why does it heat it up? Couple reasons.
To bring blood to the area?
To speed up metabolism, because you warm things up, they metabolize faster.
Yes, right.
And to increase blood flow, because that's going to speed up healing. Don't you think our biology, in however many thousands of years we are old, maybe 30,000, don't you think by survival of the fittest, if that was really going on, our bodies have figured out how to heal us as best they could without the surgery in the hospitals and stuff? And so your body heats it up because that's the right thing to do. If you cool it down and you go home and put ice on it and take anti-inflammatory drugs, you've just stopped the
body's natural inflammatory process, which it needs for the healing.
And now you're not going to heal as well. You've just taken away your potential and ability to heal and decreased it. There's a wonderful study that was done several years ago giving Army recruits...
Let's appreciate the irony of that, Hal. you know, right? Exactly.
Okay. But there was a study done...
How did that happen?
And these army people were given meloxicam, which is an anti-inflammatory drug. And those who took the drug got back to work faster, had less pain and less swelling. But 6 months later still had unstable ankles that were uncomfortable because they never healed.
Yeah. Removal of the symptoms, the pain symptoms, and no healing.
Right. So you want that part of inflammation.
Yeah.
You don't want the inflammation that causes you pain. Well, it turns out a lot of the inflammation that causes pain is a reaction in the fascia that holds us together caused by the food that we shouldn't be eating.
Okay, so the plot thickens.
The plot thickens. So aside from the injury, which we still haven't gotten to, because that's really the source of the pain, what makes those injuries light up like you just plugged them in and set all the light bulbs up,
Is
is
the
the food that
inflammatory
causes an
based
inflammatory
food.
reaction in your body that you should never be eating.
And those foods are?
Bread flour, sugar, potato, fruit juice, artificial sweeteners, fake fat,
All my favorites.
all the things that are not
I'm
real
kidding.
food,
Yes, right.
right?
Right.
All the things
They're
that are not addictive,
real.
but they really nutrient. Yeah, the things that nutrient you don't do that.
Right.
Things that
Nourish.
cause the inflammation that don't nourish you as well. They may keep you from getting skinny, and they may keep you from looking like you haven't been fed. And they may make you really big, the opposite of looking like you haven't been fed.
Right.
Because those foods that we just mentioned, we call big people food. You can never be a big people eating little people food, right? You have to be, and the big people food causes inflammation that makes you hurt.
So interesting. So pain would almost be subacute had it not been for these inflammatory foods, which really light the whole thing up.
Even more so, and just to drive that point home a little bit, I have done this experiment where once a year I've gone out and skied. Now, I used to ski when I was a kid, so I've got a skill set, but I haven't done it in 20 years. And so I put skis on and think I could do what I used to do when I'm no longer strong enough to do that. But you can imagine that I pulled on my strings pretty hard, and I really worked at the skiing.
Yes.
You get out of the car after the hour drive home and, oh, you know how that feels. And you're worried about the next day. And I went home and I took my warm shower and massaged my muscles and did all the things that I woke up the next day fine. Not because I didn't have any injuries from the day before, but because my food was so clean that my body repaired those injuries under my radar and didn't even let me know that I was hurt.
That's very instructive.
And to make sure it wasn't a fluke, I've skied 3 years in a row, 1 day a year, and repeated it 3 times.
Painlessly.
Painlessly. A little bit of discomfort, but nothing like what you would expect from doing a very strenuous activity that you're foreign to because you haven't been warming up or, you just go right into running your marathon.
Sure.
You should be pretty miserable the next
Yeah.
day. Except for I didn't eat any of the food that would have inflamed my healing response, and my body just worked at healing.
So this is a slightly altered understanding of the mechanism of pain. When someone comes to you, Hal, what happens? Give an example, if you would, please, of, maybe someone in particular who came and got your treatment and has been suffering for umpteen years, and then all of a sudden, voila, some changes.
So most people have an idea of where their pain comes from. They've seen other specialists who give them also those ideas. So the first thing I want to do is listen to what you've been told and what you've learned, and then also hear how your body has progressed, if it's progressed, rather than going backwards. And then the key is, I need to touch you. And you'll find, or what I find, is that many patients who have pain, the doctor has never touched them. Their diagnosis has been by X-ray, by MRI scan. Your chiropractor looks at you, he touches you, because he has to adjust you. But your diagnosis is the X-ray and what he reads on the X-ray, and then what he feels secondary. Your orthopedic surgeon doesn't really touch you. Your orthopedic surgeon and your neurologist pokes you with needles to see where you're numb, then orders an MRI scan and an X-ray and shows you where your disc is pinching on a nerve and that you need surgery, and still hasn't touched you.
As a therapist, counselor, and acupuncturist, I'm deeply offended by this fact. It really is. It's someone who has been in touch with, no pun intended, the healing power of touch.
Right.
And knowing how children need to be touched,
Right.
or they do not get proper brain development. I mean, that's how serious and important touch is in infancy. And you can just extend that same understanding forward for the rest of one's life.
Yeah.
And oxytocin release, etc. That's
And
how
one of the
important.
most bizarre things I ever heard in a pain conference was a specialist from the American Pain Society who said, we encourage physical therapists not to touch the pain patient because then the pain patient will want to come back to therapy just to be touched and they won't ever be discharged. Isn't that sick?
Profoundly.
Profoundly. Well, that's what our colleagues have been taught for all these years. And what we're trying to show is most of what we were taught about pain is not the way our biology works. And if you think about it a different way, most of the chronic pain people suffer with can actually go away. And that's what we're here to talk about.
Exactly.
An entirely different paradigm.
So go into, if you would, an example of someone that you've worked with. They come in, they've been getting standard conventional treatment, it's not working, and those are the people I imagine are coming to your doorstep.
Yes. Headaches too.
Mm-hmm.
And headaches don't come from your head. And if you can touch the piece that sends off the headache and people realize, oh, that's where my headache comes from.
Oh, yes.
And just do this and see how they go away and they don't come back. That means changing your food. That means working on your body. That means unkinking the fascia from the injuries that you've had through your lifetime. So the most important part of what I do on the first visit is to touch.
Mm-hmm.
And you'll find that we have a skill set that we've developed that we can also teach, that I can touch your body and by your texture, the texture of your fascia, know where your injuries are through your lifetime and know where you're tender without you having to tell me where to find it.
Well, the body is telling you.
Your
The
body
fascia
will tell me.
is telling.
So I will usually introduce that by,
Sure.
let's find out two things. One, let's find out what your body can teach us that you may or may not know.
Right.
And second, the most important thing, let's find out if what I feel on my side of your skin is the same thing you feel on your side of your skin without you having to tell me. Because once you know that I feel what you feel, the average chronic pain patient goes to a new doctor with one thought in mind, or I need to convince this doctor that I really have a problem, that I'm not faking, that my pain is real. That is a major concern of people with chronic pain, whether they're going to be believed.
It makes sense, because the other side of all of this is that pain is very subjective.
Right.
And it's
And
not
it is
measurable.
Your
as
experience
such.
of it is subjective.
That's right.
Your injuries are not.
That's right.
And if I can show you them, and as I'm touching your body, you go, wow, how did you know that was tender? I didn't tell you. And you realize that I know what's going on in your body, and that changes our relationship in the first 10 minutes.
Absolutely. So you were telling me, Hal, about a woman from Long Island who recently came.
And she's had pelvic pain and headaches and pain all over her body for a long, long time.
Yes.
And she's been in therapy for a long time. And her physical therapist sent her to me.
Mm-hmm.
And I find these injuries all over her body, show her where all this pain is coming from, and then I take out my tools of the trade and unlock the fascia strings that are binding her and holding her in pain. And now this is 4 weeks later, and so much of her pain is gone from that one visit. And what she's been able to do in physical therapy is remarkably different with the strength and the exercises that her therapist has her doing. Another real profound success is a woman with rheumatoid arthritis. She's in her early 30s, so she got it in her early 20s. She had too many vaccines at one time is what it's been attributed to. And by the time she gets to me with this 10-year history, her fingers are going sideways, her knuckles are swollen. She can't move this elbow. If you look at the x-ray, you almost can't see the bone. It's so faded, there's not enough calcium. And she moves it by holding her other hand. And I have to put needles and do work on her arm. And I can't move her elbow, she has to. That's her first visits with me. This woman has had platelet-rich plasma, stem cells, peptides, a very clean diet, all herbal medicines, everything we could do. And now it's 3 years later.
Since she started coming.
Since she started coming.
Mm-hmm.
She can wear gloves on her hands now she hasn't been able to wear in years because her fingers aren't so swollen. She came in last time, she can actually move her elbow without the other hand holding it.
Can you see the elbow now?
We ordered x-rays. We're hoping we can see the elbow. She's able to work 2 jobs, and 3 years ago she was an invalid. She couldn't work at all. And the people that the society where she belongs have decided it's better to spend several $1,000s and help her body recover and restore from this awfully just devastating process and make her a productive member of their society rather than having to support her as an invalid for another 60 years, paying for her medical care and her doctors and her drugs and
And that she's depressed because she can't do anything.
And even if she lives that, and then she can't cook for herself, right. And now she's no longer crippled. She can work 2 jobs. And she had a really bad case of rheumatoid arthritis, and her biology is restoring her body and putting it back together as best as it can.
Because that's what biology does.
Exactly. And with the work that we've been able to do, she's making this happen. Well, this is true not just for headaches, but for pelvic pain, for the pain you think might be coming from your prostate. You know, if your doctor suspects a prostate infection, antibiotics might be the right thing. But 6 months of doing that, it can't be an infection. Something else is causing the pain. And nobody knows how to touch you, and nobody knows where to look for it.
Well, you're bringing up a whole interesting subject that has interested me forever, because I've been studying the body in many different ways through the lens of Chinese medicine, and because I was exposed to Rolfing very early in my life, when I was a teenager, I came to appreciate the power and role of fascia. Yes. Not nearly as developed as yourself, of course, but
although Rolfing is at the core.
I had a kind of a view into the structure of the body, and not to mention body language and posture language and all of that, and what it says, speaks, and how we hold ourselves, etc. So I appreciate the direction that you have been going in for, at this point, a long, long time. You've also moved into the area of craniosacral and in
healing touch and energy
healing
work.
Touch, exactly. Yes. So talk a little bit about how that integrates into your work.
I think that those skill sets really taught me how to touch. When I was early on in my career and just developing, and I had learned and taught myself myofascial medicine patterned after my mentor, Dr. Janet Travell. And it's not like
Was she an orthopedist?
No, she was a physiatrist.
A physiatrist? Oh, yes. Interesting.
And
most people don't even know what a physiatrist is, frankly, but it's an MD level physical therapist, in case you don't know.
Right. And they're the ones that will help rehab you after your stroke, and they should know a lot about pain, and they know a lot about how the body works and muscles and function and all that. And I started to teach myself how all that worked. And I remember I'd opened my own practice. I was a couple years into it. My wife comes home one day and she says, "There's a physical therapist I've met. You need to meet her. I've invited her over for dinner." And Vicky came over for dinner one night, and she introduces and leads with telling me my skull bones move. Now,
which, according to ordinary medical
I went
training,
to medical school.
You didn't know that.
And I told her, well, maybe yours do.
Believe mine out of it.
Mine fused when I was 2 years old, and I don't think they've moved ever since. Well, after we had dinner, it didn't take very long for her to show me that my skull bones moved. And I didn't believe it at first till she put her head in my hands, and I knew my hands weren't moving.
Oh.
And something in my hands was very much alive and squiggly.
Oh, isn't that interesting?
And her skull pulsed.
Yes.
And I was so intrigued by that. I started to wonder, what else was I taught that is that wrong?
Right.
And I was so intrigued by that, I took enough craniosacral therapy courses. I'm a craniosacral therapist. And in that process, I also learned, thank you, that you can feel energy fields off a body. Well, that was black magic to an orthopedic surgeon, you know. But I could feel them and touch them. And I don't believe anything I can't touch and feel. That's a bar for me.
Yes.
And Janet Menken originated Healing Touch, and she lived in my town. And one of my staff wanted to...
Dolores Krieger from NYU?
That was Nursing Touch. That was different. Janet Menken did Healing Touch. There was another one for nurses.
There's something, right. It was definitely nurses that she was addressing. Oh,
right.
Okay.
They're really the same thing.
Yes.
And so is Reiki, the same thing, just variations on
with
the theme.
a different type of tradition, absolutely.
Yeah, but they're the same idea.
Yes.
And so I learned that you could do things off body, and one of my staff wanted to become a Healing Touch therapist, so I took the classes with her. Well, those things taught me how to touch and gave me an appreciation for texture that you don't get poking people. We were taught to poke people.
If you touch them at all, that is.
Yes, and I learned how to scan.
Yes.
And I also learned that the softer you touch someone, the more their biology will trust you and the more information it will give you.
Exactly.
And if you go at somebody hard, they do this, they
Stiffen
close
up,
off, and you
contract.
can't feel anything. So just a really light touch was all it would really take. That was also fascinating. My wife taught me that one. She's taught me a lot. She goes to a shiatsu therapist.
Wives can do that.
Yes, they do.
Women can do that.
And they don't even have to be wives.
No, they don't.
So she comes back from the shiatsu therapist who says, your husband knows enough about this. Why doesn't he do this to you? She goes, because his hands are too tired at the end of the day.
Oh,
And he goes, well, why are his hands so tired?
interesting.
And my wife says, from pushing on people's trigger points and feeling their fascia all day long. And Charlie says, why does he have to push on them? Why can't he just sense that they're there? Really? So, I mean, craniosacral therapy, healing touch, sense that they're there. It kind of hits me in the nerve, right? That was the last time I pushed on anybody hard
Wow.
when I didn't have to prove a point. And I found that the lighter my touch was, the more I learned and the faster I learned it.
I appreciate this. Of course, I have also studied Alexander technique, and I have also taken classes in Feldenkrais. So believe me, I'm on the page. But I've also been Rolfed a number of times. And even what you were doing to me earlier requires some intense touch as you're moving through the fascia.
Right.
So talk. This is contrast.
It is not comfortable, the work to get you out of pain, but it does unkink the strings and get you out of pain. So when I started to really put pain together, I came up with 5 rules. And those 5 rules really help our understanding. So that
would help us to know those.
The 5 rules of figuring out where your pain comes from. Rule number 1, pain does not come from where you feel it. That's a rule. Your headache does not come from your head.
It's always referred, basically.
Your headache doesn't come from your head. The pain in your left arm could be your heart attack. You have no idea. The pain in your knee comes partly from your joint, maybe, but most of it does not come from your joint. How do you know? Talk to your friends who've had their knee replaced and do a little survey of how many still have knee pain and the knee isn't even there anymore. Lots of people end up pain-free, but
phantom pain?
Not phantom. There's a reason for it.
It wasn't there in the first place.
Right. The pain was there in the first place.
No,
That's why
it wasn't in the knee in the first place.
Correct.
Yeah.
Another example is the phantom pain. I wasn't even going to mention that, of an amputation. You still think the pain comes from your foot. Same thing. The pain doesn't come from where you feel it.
It's really important.
Rule number 2. This is a big one. It's not important what you think that pain feels like. We spend a lot of time...
You may think so.
Exactly. We spend a lot of time writing down all the nuances of the history, right? So where is it numb? Where does it burn? Where does it tingle? Where is it sharp? Where is it stabbing?
Right.
All those things. Your brain cannot tell the difference from the pain signal. Numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing. None of them make any difference, and none of those words are diagnostic. Well, we were taught they were. We were taught that burning and tingling mean nerve. Totally nonsense. The numbness in your leg that you think is coming from your disc likely does not come from your disc. The weakness in your muscle, because the muscle doesn't get the signal, that can come from your disc, but not always.
Yes.
There was a man who saw me.
So you need to do, as you said before, a whole body scan.
I need to touch you
to know origins of pain in one place.
And then we can even demonstrate on you.
Okay, sure.
So rule number 3, you can't believe where you feel it. You can't believe what it feels like. What can you believe? The only thing you can believe is that where your biology is specifically tender, millimeter by millimeter, represents either where the fascia strings that hold you together are kinked and tied in a knot, or where those fascia strings anchor and weave to you and you've injured them. That's the only thing you can believe. Rule number 4, the places where you are specifically most tender cause most of the pain you have. And rule number 5, As quickly as you unkink the strings, and as quickly as you heal where they anchor and hold on to you, the pain you thought you had will go away, no matter how many years you've had it. That's true 90% of the time. 90% of the time, that's true. God. What we were taught about pain is true 10% of the time. That means 90% it misses. When you come to me and you tell me that your pain comes from a bulging disc, I'm going to tell you that bulging discs are normal. They're supposed to bulge, and they don't cause pain. You're going to tell me your pain comes from a herniated disc. I'm going to tell you might be right. Let's look at your MRI. But here's a really cool example. I got two to tell you. A man came to me about 15 years ago. He was 31 years old. He's a bodybuilder, so he was out lifting weights 3 weeks before, ran a mile and a half after his weightlifting session, wakes up the next morning with pain in his lower back going down his leg. He's already seen the neurosurgeon. He's already scheduled for surgery next week, and he comes in to see me. And I test his reflexes and his strength and all that, and I said, I don't think I can help you. He goes, why not? I said, because your MRI says herniated disc, free fragment, migrated inferiorly and pushing on nerve. That's as strong as it gets. And I said, and the nerve it's pushing on, you got weakness in your leg, and you've got reflex changes. Everything that I've learned tells me you need the surgery. He says, great. But there's a problem I have with that. I'm a bodybuilder, and I'm not doing the surgery. Also, I've heard you're pretty good with needles. So let's see what you got. Well, I am pretty good with a needle, and he didn't have to invite me twice. I figured the work I do can't harm you. So I can cause you some discomfort in our learning process, but I'm not going to cause you damage. So it's okay to do what I'm not sure of.
Right.
So I injected the trigger points in his lower back.
Doctor, do no harm.
Doctor, do no harm. Really hard to live by with what we've got going on today.
God, yes.
And I injected the muscle in his butt muscles too. And he comes back in 2 weeks and 90% of his pain is gone. 2 more visits, the rest of it goes away. Okay, so he's discharged. He comes back 10 years later. Same pain. I did the same thing again. Pain goes away again. And now I said, you have health insurance? Can we get an MRI? He said, what for? I said, because I'm wondering about that disc 10 years ago. I'd like to know what I did.
Yeah.
Because we took the pain away, right? And
Sure.
I've still been wondering for 10 years. We did another MRI. He's got 4 levels of herniated discs now. No free fragment anymore. That was gone. But herniated disc at 1, 2, 3, and 4. And he's pain-free. Wow. Okay. Here's another one. This man comes in and everybody colors
and then we'll catch more after this one because we're running out of time.
He colors yellow down to the bottom of his feet, which means they're numb. And he settles his workers' comp claim, and he can afford the higher end of what we do with platelet-rich plasma. And I go to repair tendons that hold his butt muscles together. And he comes in a month later and tells me, 3rd day after the procedure we did, since then, for the first time in 10 years, and he had his lumbar surgery 10 years prior, for the first time in 10 years, he can feel his dog lick the bottoms of his feet. So, do we really know where the numbness comes from? Everybody thought it was the pinched nerve and the surgery and the disc. And I do this procedure and he can feel his dog lick his feet?
Yes.
So what we were taught about pain works about 10% of the time. And what I'm teaching about pain works better than 90% of the time, no matter how long you've hurt.
And it's also, by and large, au naturel.
Yes.
I mean, you're using natural remedies and treatments.
Right. It's not about drugs.
Artificial.
Right. And it's not about years in physical therapy. Should we show people about your elbow?
Yeah, let's take a quick moment.
So
it's okay. You can use my left arm.
Okay. So if you just watch your talking finger, we can make it dance.
Yeah.
And I can tell you that texture of that tendon that makes that move, that's where your kink is and where you're wounded. And down here where it's not tender, same tendon is not where the kink is. The kink is here where you twitch. And the wound
That's why I always like to be massaged here.
Yes. And the wound is up here where you hold together. And you've pulled hard enough to slip that. And that's how you twist into this. And you've got
So
wounds
interesting.
all over your body the same way.
Yes.
From your shoulders that cause your headaches, to your back, to your butt, to your feet.
And everyone does,
And everyone
to
does.
one degree or another.
Right.
But it's subacute, so to speak. It's not very acute at all in reality. But the point is that it's there, but we have learned to live with, adapt to these states of body and mind.
And most of us have believed that we can't make it go away.
Right.
Because we try all these things and nothing works. And that's why we have all these OTC medicines and braces and this and that. And the truth is, you can restore yourself from these injuries that have occurred to your body through your lifetime. And you can make the pain go away. Not better. Better is great. But under your radar is really nice.
Disappear.
And just like this elbow, you don't really know that hurts until I touch it and show you you've got a wound there.
Right.
We spend half of our brain power, our bandwidth, ignoring our body. So you don't need to be 100% good. You need to be 99% ignorable.
Yes, exactly.
So you need to fine-tune your selective hearing so the things you don't want to hear aren't loud enough to speak.
That's right.
And now your pain's gone.
Hal, you're doing beautiful work, and this is so important. And especially in a day where pain management has become so big because so many people are getting hurt in such a myriad of ways.
Right.
It's really serious. And opioids and everything else are just dominating the field. And
as much as the opioids are in the news, they are the safest drug and the least toxic drug for pain, which is a shame because they are that good and you tend to want to use them more. And if you just use small amounts, they work really, really well. And if you use the other drugs, like the anti-inflammatory drugs, kidney failure, ulcers, heart attacks, and they stop you from restoring the cartilage in your joints from daily wear and tear. Opiates are way safer than that, but they can be used in a safer manner than they're being used today.
We're going to have you back on to continue this conversation.
I would like that very much.
Would you?
Yeah.
Okay.
I hope everybody got a lot out of this and enjoys it a lot.
Ouch! No, I'm kidding you.
I was going to say that.
Don't steal my lines.
Never.
Thank you, Hal.
Thank you,
Beautiful
Mitch.
work.
Okay.
Absolutely. Dr. Hal Blatman is, well, that's just a taste of what it is you have in store if you keep tuning in and hearing what he has to say in subsequent shows. This is Mitchell J. Rabin for A Better World. Thanks so much for joining us. Please give us some comments. Love to hear from you at mjr@abetterworld.net. Visit our website, of course, www.abetterworld.tv, and join our mailing list. Love to have you for our weekly free newsletter announcing our weekly radio and TV show. Thanks again, and look forward to seeing you all next week.
Do you know a musician who is suffering from pain or trying to avoid surgery that could end their career? Finger pain from joints and muscles, cramps in forearms, headaches, neck and shoulder pain, drummers with muscle and joint pain. At the Blatman Health and Wellness Center, we have experience in treating musician injuries and pain, saving careers of instrumentalists, playing strings, keyboard, percussion, and more. If you know a musician who needs help to continue in the life they love, share this post and help them get the help they need.